So my name is Caleb, and this is my second time. I came around here last summer to see Dr. Ben, and I love the results so far. So this would be my second TCA Cross session, and I've seen the results. And it's improved about 30%, and it's probably the best procedure that I have done for my acne scars. Because before I've done several sessions of microneedling and it didn't really have an effect on me, but this procedure, it's been the best. So I'm really looking forward to it, and my scars have improved dramatically. So my family has complimented me a lot on my scars, because my scars, they used to be like more severe and deep, but they're not so much anymore now because of this procedure. So I'm glad about that. Well, it's improved my confidence a lot, because before I used to be like more self-conscious about my scars, but I'm not so much anymore now because it's improved. So like I don't have to worry about that. So it's like the anxiety is gone, now. When I go to meet like new people, like I'm not worried about my scars as much anymore now. So that's been a great thing. I would totally recommend it. I think it's really helped improve my confidence, and it's like decreased my anxiety about my scars because they've improved so much. So yes, I would definitely recommend this procedure. The downtime was maybe just a week, I would say. So it wasn't that bad. So I was at work and I was going to school still. As almost just like minor scabs on the face, but other than that, it's not that bad. So I was able to go to work the next day and school still. It's a really quick procedure. Probably took maybe like 10 to 15 minutes, so it wasn't that long. So I would recommend that if you have like ice pick scars, to get this, because it's like the best option for you and it improves it the most. So like I would say, like if you have like ice pick scars, to definitely get this procedure done.
Hello, welcome. This is Dr. Ben. I'm a board certified dermatologist and I specialize in acne scars. And today we're joined one of our lovely patients who is here for acne scar treatment. Welcome.
Thank you.
So we have done about 2 sessions of TCA Cross on him. He had a lot of ice pick scars on both sides, and we did 2 sessions. And he's not back for follow-up, he's back for the 3rd one. And again, I usually recommend multiple sessions, so he's kind of in the middle of his treatment course. So he's not going to be 100% better, but he's definitely going to be improved. So now we're going to ask him some questions. So first of all, I know a lot of people are cautious about basically doing actually TCA and more olive skin tone, darker skin individuals. Did you have any problems with pigmentation changes or scarring or discoloration from the TCA Cross?
Not at all.
Not at all. Okay, perfect. We usually use a bleaching cream before or afterwards to reduce the risk of pigmentation changes, and that really allows us to treat darker skin individuals. Number 2, we did TCA twice. Did it hurt, burn? Was it very uncomfortable?
Not at all, it didn't.
Okay, and with respect to the improvements, what percentage would you say they got improvement?
I would say about 30%.
30%, yeah, so that's about a little better than average. So I usually say about 10 to 15% per session. So we did 2 sessions, we got about 30% improvement. We're actually going to show his before and after photos, and you can see actually some of the spots on the left cheek honestly almost went away. But overall, I would say 30%. A lot of the deeper ice pick scars filled in and they're more shallow. Now, has anybody noticed, any of your friends or anything, have they commented anything on it?
I feel like my family has noticed that it's improved like dramatically a lot, so.
Perfect, that's great. What does that make you feel about your confidence? What do you?
Yeah, like it just raises it, and I have like no anxiety anymore, about like my scars. So.
I love it, no anxiety about the scar. See, if we could do anything without any medication to reduce anxiety, this is the most important thing. I love it. So today we're gonna do the 3rd session. You're excited about this?
Yes.
Perfect. Okay guys, so I always use basically TCA 80%. Again, do not try this at home. Only doctors should do this. Experienced physicians doing TCA. And again, I do a lot of TCA. So please sit all the way back. So what we're going to do, we're going to identify the ice pick scars and we're going to basically dab into it. The ones that are a little bit more broader, we're going to use what's called the painting technique. Here we go. So what's going to happen is it's going to sting a little bit. So I'm going to hit like a lot of these small ones. And then he's going to start to frost up. I usually see my patients back anywhere from 4 to 6 weeks. If you're darker, it's about 6 weeks to do another session. If you're lighter skin colors, I do about 4 weeks. How are you feeling?
It feels good.
Good. So again, with TCA Cross, it's typically done multiple sessions. I like to combine it with other treatment modalities like subcision and laser. Again, not necessarily at the same time, but at some point. A lot of patients do about 3 to 4 TCA sessions, 1 to 2 subcision, and they do laser towards the end. TCA stimulates collagen production and fills it in. And again, we're going to show the before photos of his left side temple, and you can see that his temples look a lot better. Also, a lot of the acne scars in the lower cheek are literally practically gone. I mean, you can see that in the photo. Unfortunately, in his skin color, you're a little bit restricted with respect to the laser, so I will not be able to do the laser option on him. So that's why the TCA Cross is such a great benefit. Okay, so please bring the camera forward. So now you can tell that a lot of the areas that I treated are basically slowly frosting up. Again, he just has a lot of small ice pick scars. So we're gonna treat. See, so it's frosting. Now, there are some people that do not frost, which is absolutely okay. How are you doing so far?
Oh, it feels good.
Perfect. Now, I want you to look the other way. Now, again, what we're going to do, we're going to hit each and every one. Actually, come back towards me a little. Okay, perfect. I love to hit like a lot of the scars. I hit ice pick scars. You just dab it in there. And I do a lot of box scars as well. Okay, should move it this way. Guys, you could tell that he is frosting up a little. Any word of advice that you would share with our audience out there?
I would say that if you have ice pick scars, to definitely get this.
I agree with you. I mean, this was originally intended for ice pick scars, and I think you have ice pick scars, and especially if you're darker skin color, honestly, I don't think there's really anything else that's going to help you.
Yeah, I tried a lot of stuff and it didn't really have an effect.
He tried a lot of stuff and didn't have any effect. And I'm hitting all these small ice pick scars, guys, one at a time. Our goal is to hit as many as we can so we can see the best result possible. Now I'm gonna go to the other side. How is the tingling and burning?
It's just a slight little ting, but it's not bad.
It's not bad, okay. We're almost done. You're doing great. Perfect. We did it all. You did great. You did really good. How was it overall?
It's not bad at all. Like, it's just a little tight little sting, but it's
not bad. Perfect. So tonight you're gonna wash your face tonight with just water. Tomorrow morning just put like a lot of sunscreen on.
okay.
Perfect. Well, thank you so much for coming. We'll see you in about 6 weeks. Okay.
Okay.
Perfect. Thank you guys.